And now, it's Boomer Life. Lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Something tells me I'm into something good.
Good morning and welcome to Boomer Life here on CIL 650. We are absolutely into something good on the program this morning, as it is my distinct pleasure to welcome back to Boomer Life the gang from Integrative Naturopathic Medical Center in Vancouver, in the person in studio today of Doctors Lawrence and Alex Chan. Larry and Alex, great to see you two again. Welcome back to Boomer Life.
Nice to be back. Thank you.
Definitely.
It's good to have you back with us. It's been over a year. We're going to talk about, on the program, we're going to talk about new cancer and anti-aging therapies at Integrative Naturopathic Medical Center. We'll talk about Chinese New Year, which is a few weeks away. And in general, talk about the prospects of living a healthier, happier life in 2016. We're all of 3 weeks into the new year. And, of course, deep in the heart of resolution season. This is the time of year when we're still clinging to those resolutions. And for people who come into the center, with new clients going, well, you know, I've made a resolution. 2016, I'm going to just generally improve my overall sense of health and well-being. Larry, where do they start?
Well, most people, if they've been with us before, it's going to be diet and exercise is everyone's resolution starting in January for sure.
Okay.
It's just like the gyms are always full in January.
Absolutely. They
for,
still
for,
are.
For 3
yes.
weeks, for at least 3 weeks. And people, we put a lot of people on cleanses because of all the excesses of the
holiday season, yes.
So we actually do a full evaluation with people coming in just to see where their status at that point is.
Alex, is it usually at this time of year, given these new people that Dr. Larry's talking about, is it mostly about weight loss? Here in January, I've made a resolution to look somewhat human by June when it comes to bathing suit season. Is that a big part of it?
There is a lot of that, especially across age groups.
Of course.
And across gender, too.
Mm-hmm.
We see both men and women. But slimmer waistlines in the new year are definitely popular.
All right. And so anywhere you want to choose to jump off and get into that whole swing of things with respect to getting yourself, turning yourself into a better, healthier human being, regardless of the excuse, good for you for getting there, right?
Even if it's just a more superficial thing like appearance that
Sure.
drives people in, it's a jumping off point, just like you're saying, in terms of promoting better health. And part of it is not about the initial weight loss, it's about maintaining
Right.
that weight loss. And that's the thing that people usually come to us for the most, is that they've done things that have caused them to lose a bunch of weight,
Right.
but then it all creeps back on.
That's right. That's right. Yeah, it never stays off.
Losing the weight is not the problem.
It's maintaining the lower weight, isn't it? Now, before we get into anti-aging and some of the new cancer treatments and therapies you've got going on, Dr. Larry Chan, back us up, sir. You are one of the original 3 founding partners of this enterprise, going back a couple of decades now. Remind us of the beginnings of Integrative Naturopathic Medical Center.
We started in 1985 as Integrative Healing Arts, and so we've had a distinct pleasure of working in Vancouver and serving the Vancouver community and the greater community. We have people come from not just BC, but from all around Canada and also globally as well to see us. And we've had a lot of fun, actually, and learning and working with people. And it started with myself and my 2 partners, Dr. Hal Brown and Dr. Eric Posen.
Right.
And it's been an interesting journey because we started as chiropractors to start with. But chiropractic itself is fantastic for keeping people healthy, especially from a back standpoint and spinal standpoint. But also we discovered it was limited from our integrative standpoint. We thought, you know, we need to incorporate nutrition. We need to incorporate much more than that in terms of, you know, even mental, emotional issues. Then we also wanted to bring in a faction with Chinese medicine.
Okay.
Models of Chinese medicine, which is fantastic for preventative of future illness as well. We wanted a measure of weight, being able to diagnose and also to evaluate risk factors that people go through. So we kind of expanded from there in '85 as chiropractors to become naturopaths as well as traditional Chinese medicine doctors.
So each of you 3 partners went back to school, didn't you?
It seemed like a never-ending quest because you go through the standard like medicine. You go through your undergraduate degree, you go through your medical training, and then we added 2 or 3 other degrees.
Specialties, right? Exactly. So talk to us a little bit about, you mentioned a name change. Let's talk about the name you've changed to and break it down. Integrative Naturopathic Medical Center. Talk to us why integrative, and let's connect the first two words. First integrative, why, and then connect it with naturopathic, please.
Sure. Well, integrative is an interesting word because we started that as integrative healing arts, and at that time we were using
That's the one word that didn't change in the title, right?
Because integrative is really about bringing all aspects of the being together from a evaluation and healing standpoint. You need to look at the physical being, the biochemical being as a person, and also the mental emotional being. So it's the integration of that process to get the person healthier, but also where is that disintegration or lack of communication occurring in the body?
Right.
That's the integration. That's one aspect. Integrating and looking at the integration of the human body and the form. And then can you bring integrative therapies together? Acupuncture, physical medicine, natural medicine. How do you put that together? Psychology. How do you put that together to help that individual become integrative again?
Right.
And that's where the name came from. We first started with integrative back in '85. Very few clinics in Canada were called integrative of any kind.
That's right.
Now, if you look around in the phone book, you'll see many clinics.
And pharmacies. And it's become a much more popular word.
Right.
But back in the day when you first started out, it was, what does that mean?
I know, exactly. And it's been a word that's represented who we are for all these years.
Now, I think, Alex, would get you back into the conversation here because naturopathic is the next word in the title of the enterprise. You are an ND, a naturopathic doctor, so who better to speak about naturopathic? Tell us about that part.
Well, and I think that that's one of the reasons why the concept of being an integrative clinic works so well as a naturopathic office. The idea that naturopathic doctors now, especially with our training, the prerequisites are basically the same as conventional medical training for our undergraduate degree. So myself, I have a Bachelor of Science. And then I went into naturopathic medicine, which essentially one of the main differences, we get the same training in terms of anatomy, physiology, even a fairly extensive pharmacology section.
Okay.
And then we also get training in some auxiliary services, including homeopathy, botanical medicine, some Chinese medicine, chiropractic, manipulation. So a whole variety of other skill sets that are less invasive generally and more preventative. So trying to use that skill set, that naturopathic skill set first, but then knowing that we always can both prescribe if we need to, and then also work with other healthcare practitioners in the conventional world. And that's where I see that integration really lies, that our clinic wants to be more than integrated in name alone.
Sure.
It's that the practitioner you're seeing can be a three-pronged approach of getting that biochemical, that mental, emotional, and that physical body in line. They've got tools to use all three different parts of that. The second level is that in our clinic ourselves, we have many different services.
Sure.
Chinese medicine, holistic nutrition, medical aesthetics, that are all natural and more preventative basis. And then outside of our clinic, we like to make sure that we can work with other conventional doctors.
Well, I was just going to say that. So would
Exactly.
the word integrative, back to that one again, would also include your ability as naturopaths to integrate with the traditional Western community around you, right?
Exactly. So it's on those three different levels, and it's so important. For me, my preference is that my patients are comfortable working with both myself and any of the other healthcare practitioners that they already have established.
Sure.
Or that...
It's not a competition, is it?
Not at all.
Right. So, and I think that's Larry, back to you. I think that's perhaps even back in the day when you were probably suffering a few slings and arrows with this integrative, whatever you call it. You were the alternative guys. You were almost the hippy dippy guys back in the mid '80s, and all of a sudden here we are, about 30 years later, and you're about as mainstream in Vancouver as they get nowadays, aren't you?
It's a funny evolution, and you're right. Back then, I would get calls sometimes from medical people saying,
The alternative guys.
That's right. What are you guys doing? You're poisoning your patients. Like, for example, best example is, 20 years ago when I prescribed patients for skin problems, 2,000, 3,000 units of vitamin D.
Okay.
Well, I get a call from MD saying you're poisoning your patients because the RDA is like 100 units a day. I just said, go read the literature. There's no saying that you can't have that much. standard prescription of vitamin D now by medical people is at least 1,000, 2,000, 10,000, 20,000 units a day.
So they finally caught up to you.
Well, the thing is that we never poisoned the patient, but now it's more mainstream. And many more medical people see the value and the power of bringing all the medicines together and looking beyond just the simple medical model.
And as you were saying, Alex, you like it. You like to see patients who integrate with MDs and the typical BC health system and who augment their treatments and therapies and peace of mind by seeing a naturopath like you.
And I feel like sometimes that's where it can seem like there's this competition.
Yeah.
And I want people to come to me and not feel that they can't tell me what other medications they're
or
taking.
They can't tell you their real doctor that they're seeing you.
Exactly.
What would he think? Oh my gosh.
When there's open communication, especially now, people are more and more demanding and really seeking out much more of a healthcare team that will work for them with their best interests at heart. And that no one should have to listen to what any one person thinks is best for you. Mm-hmm. That's kind of counterproductive.
And we've been stuck in the model that Western medicine is scientific and everything else, alternative or complementary, is not scientific.
Right.
So therefore, everything is worthless and only a scientific model stands. Well, I think some of the medical people recognize how limited that is at this point in time.
Yes.
And really, when it comes to Chinese medicine, there's a 5,000-year-old pharmacopoeia. There's so much experience and written knowledge about that already. Mm-hmm. It's not the standard double-blind studies, but boy, there's so many things you can't do double-blind studies on. And homeopathy and all the other traditions, they have a tremendous amount of data and background information that supports the treatments and the therapies.
And what we see is that not all things that are done on the conventional side are evidence-based with double-blind studies either.
Oh, that's true. That's absolutely true.
So I think that there's a give and take. As well, we see that a lot of the herbs and other supplements we use, the research is now catching up.
Sure.
So it kind of goes both ways, and science is very important. The first things, obviously, are safety first, right?
Of course.
And then we have to look for efficacy, but that can be sometimes in the case of seeing what effect it's happening with the patient first. And maybe we don't necessarily have some of the double-blind effective studies yet, but I think that a lot of that is starting to build more and more.
Would you say, Larry, that a typical Western traditional med student, say out at UBC Med School right now, is considerably more aware of and respectful of the older forms of medicine that you took so much grief about when you started out in 1985?
I think that the patients and the community in general, and with more knowledge accessible through internet and things like that now, it forces them to look at that much more so. So there's a much more acceptance from that standpoint.
Right.
There still is a big faction of establishment that won't bend to look at alternative medicine as being viable as well. I think the key thing that we're looking at is the fact that we, in our clinic, in the integrative model, you look at each individual as a patient, as an individual.
Sure.
And you don't try to fit them into a system. You're trying to see what's best for that individual.
Alex, would you say, and I'm talking in very general terms here, but I'm trying to just give an understanding of what Integrative Naturopathic Medical Center is all about. Would you say, would you agree that Western medicine and its approach to its patients is more reactive, whereas traditional forms of medicine or Eastern medicine is more proactive? Western medicine reacts to, you go to the doctor only when you have a problem, and then you get a prescription or you get some kind of fix. Whereas if you approach a naturopath like yourself and you get into a program of maintenance, then you're always aware of the big picture, and so your problem load is probably going to be a little lighter, too, because of that.
I think that's definitely a good way of looking at it. I think that conventional medicine is beautifully suited to deal with acute problems. And most people who think about going to the doctor, especially I think in the boomer demographic, think that you go when you're ill.
That's right. You don't bother the doctor unless you've got a real problem.
Yeah, and now we're seeing more people being like, well, I feel okay, but I want to feel great.
Yeah.
And I want to feel great as I get older, too. And that's where I think that what we do really has an amazing role to play. Also because of the fact that we have more time with our patients.
Yes.
I actually have time to sit there and get a full history in terms of what are the other stress factors that are impacting your life. And that gives me more ability to then work with that lifestyle component and then also provide coaching in terms of some of the hard changes, because the hardest things are going home and having to do the work yourself.
Right.
Because more often than not, that's a bigger part of my prescription than a pharmaceutical that you can take for a couple of weeks and be done with it.
There's more than just taking the pill. There's diet, there's exercise, there's follow-up, and plenty of it.
Exactly.
We need to take a quick break here. Our guests, Dr. Larry Chan and Dr. Alex Chan from Integrative Naturopathic Medical Center, which, by the way, friends, is right here in town at 1285 West Broadway, up there on the 7th floor. You can check them out online, too. The website is IntegrativeNMC.ca. Have a look while we take this quick break.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.